So friends, let us talk about the various components of hypermetropia. So the first thing that is the hypermetropia, that is we call as a total hypermetropia. So total hypermetropia is something that we get after cycloplegia with atropine. We know the atropine is the strongest cycloplegic agent that is there, and it basically takes care of the both ciliary tone and as well as the accommodative effort of the patient. Okay, so that, let's say we have done a retinoscopy with the help of atropine, and then we do a retinoscopy of the patient. Whatever the value that we get is the total hypermetropia. Now what are the other components? The second component we should know is the latent hypermetropia, which is there in only some of the patients. So latent hypermetropia is, let's say there is a young adult, and because of the ciliary muscle, so a small tonus which is because of the ciliary muscle, let's say 0.25 or 0.5 diopter, that basically contributes to the hypermetropia. That is called a latent hypermetropia. The next thing is, what is manifest hypermetropia? So manifest hypermetropia has two components. One component is called a facultative hypermetropia. Facultative hypermetropia is something that is basically corrected by the accommodative effort. Okay, so let's say the patient is doing a bit of accommodation, squeezing the eye, and that is basically causing it. So that is something which is corrected by the accommodative effort. And when we get a term which is called a absolute hypermetropia, absolute hypermetropia is something that can't be corrected by anything. Okay, that can't be corrected by your accommodative effort. So let's say we are doing a retinoscopy of a child, and even after the accommodative effort, the patient is getting some retinoscopy value, let's say +2 diopter or +3 diopter. That is basically called absolute hypermetropia. So in this question they have asked about something where they are asking about that the patient is having a latent hypermetropia, that is 2 diopter, and they have mentioned that the patient is having a manifest hypermetropia as 3 diopter, sorry, as a 4 diopter. So what would be the total hypermetropia? So the total hypermetropia in this case would be latent plus manifest, so that would be 6 diopter. Okay, they have also basically told that we have a facultative hypermetropia here. So the facultative hypermetropia here is 3 diopter. Okay, so if they ask about what is the absolute hypermetropia, so absolute hypermetropia is basically something which is manifest minus facultative, as you can see from the above slide. So that would be here almost 1 diopter. Okay, so in this way you can basically calculate the various types of hypermetropia.